Michio, as you listened to Mr. Abe's resignation announcement, what stood out for you?
Well, as he spoke, we realized that his voice was weaker than usual. And also, his eyes were about to, become watery. So it shows that, he is not happy to actually resign. But he did explain to us, what had happened, that it's from his regular checkup in June. There were signs of the reemergence of the inflammation of his intestine. He had that problem ever since he was a teenager, and it's worsened when he was prime minister from 2006 to 2007. Now, this time he was taking new medication, so he explained that's why he was all right to perform his duties. Since 2012. He was able to give out all he could, but it was different from this July. He felt that his condition was not good. He went for further tests in August. He had additional medication. And he says it's working, but there's uncertainty whether his condition will remain stable. And he said that he was not confident to be able to perform his duties to the best of his ability. So he decided to resign, and he bowed deeply. And he thanked the public for all their support during the past elections, as he was able to win all upper house and lower house elections. Now, he said that he decided to step down at this time, as the new cases of COVID-19 has been falling since July, and he's been able to introduce a new policy for COVID-19 as Japan has more understanding about this pandemic.
Yeah, it was interesting that Mr. Abe actually touched on the fight against COVID-19 even before his announcement, almost in a sense of wanting to hand over that aspect of the government in good order. So what measures are in place, given that the flu season is upon us and the cold weather as well?
Well, actually, initially, the media was told that the purpose of this news conference will be announcing a new COVID-19 package. Well, he did announce this in the beginning of his news conference. He says that testing will be stepped up ahead of the fall-winter season, and increasing antigen testing with a capability of 200,000 people testing a day, and regular testing for all medical workers where COVID-19 is spreading, testing for all elderly people who request testing, and on COVID-19 patients, hospitalization for those in serious conditions and those with mild symptoms or no symptoms, asking them they should stay at home or in designated hotels. Now, the new policy also indicates testing over 10,000 people a day at major airports upon arrivals from overseas. And now this is as Japan plans to ease overseas traveling from September. And it also wants to open a testing center for business travelers and vaccine for all citizens by the first half of next year. If there's any side effect, then the government is expected to subsidize. So all these, this package that Prime Minister has prepared before announcing that he is stepping down.